A year on from the outset of the COVID-19 pandemic in Peru, and the virus continues to hammer the country. The figures for excess mortality, the difference between deaths from all causes during the pandemic and the historic seasonal average, are more than double Peru's official figure for COVID-19 deaths of more than 53,000. In urban centres like Lima, the number of deaths has been almost 3 times above the normal level. The capital's main public hospitals like the Almenara behind me have been running on empty since the beginning of the year, when the second COVID wave hit with greater force than the first. As Peruvians go to the vote this weekend, the number of daily deaths and infections have already surpassed the peak of the pandemic in 2020. A chronic shortage of intensive care beds and medicinal oxygen has worsened the situation. Healthcare workers took to the streets again this week to protest over labour conditions and a lack of medical supplies as they battle the brutal second wave of the coronavirus pandemic. Add to this deadly cocktail the arrival of a new COVID-19 variant known as P1.
The rapid and violent diffusion of this Brazilian variant has become a predetermining factor in Latin America. It's not just a much more contagious variant, but also increases the levels of reinfection, which reduces the efficacy of the vaccines.
The variant, which was first discovered in the Brazilian city of Manaus, has already been traced in 40% of COVID-19 infections in Lima. As his time in office nears the end, Peru's caretaker president acknowledged Peru was woefully unprepared for the COVID-19 outbreak.
Regrettably,
the pandemic has shown us how we have failed. Several years of sustained economic growth was not used to invest in a decent public health system.
While neighbouring Chile postponed a vote this weekend because of a surge in second wave COVID-19 cases, Peru's political instability means it cannot hold off, despite the risks. Dan Collins, CGTN, Lima.